Hello, my name is Dr. Saib Gallagher. I'm a plastic and reconstructive surgeon, and in this video I'm going to talk to you about two of the biggest things we see, or the biggest myths we see when it comes to scar care that may actually be harmful in some cases, and we see patients still believing in this stuff, and I'm going to tell you what they are and why you shouldn't do them. So first of all, full disclosure, up until quite recently, I was recommending the first of these, and that is scar massage. So what we used to recommend to patients was that about 6 weeks after surgery, you would rub your scar in circular motions, and that helps kind of break down the tissues in there. Now, it turns out when we look back and do what's called a meta-analysis, we put a bunch of studies together to get as much information as possible. It looks like this scar massage probably does nothing. So we're probably wasting our time. I mean, we're maybe moisturizing the scar if we're using a lotion, but other than that, it's not really doing any good. And then additionally, as we learn more about what forms a bad scar or a raised or hypertrophic scar, we understand that it's inflammation that is going on in the dermis in there. And one theory that seems to be panning out on recent studies is a lot of movement through that scar causes problems. So we have this new concept of, fairly new concept of scar rest, and we understand that it's probably more important than we previously thought that we try to not put too much movement through that scar. And if you think about it, what we're doing with scar massage is just that. We're putting movement through the scar. So it is theorized that in high-risk folks, so folks that are prone to keloid or hypertrophic scarring, that massaging the scar may actually cause some harm. So massaging is very last year, it's out, and we don't recommend that anymore. Now, the second thing, which is from way back, and plastic surgeons have really taken it out of their recommendations for many years now, is vitamin E. So vitamin E was thought to do good for scars, and again, that was really debunked a few years ago, and there was some theory that it may even cause harm. If you do want to put something on your scars, the better option is going to be some sort of gel or strip with a gel on it. We used to think it had to be silicone, but it can be hydrocolloid or anything that forms a gel over the scar. We're not 100% sure why this works. It may be something got to do with creating a moisture barrier over that wound, but scar, but we do know that this certainly helps, and this is probably where you're going to get the most bang for your buck when it comes to spending money on your scars. There are other things we can do for the scars. We now know that steroids are quite effective. Well, we've known this for a long time, but we now understand more about why in order to subdue that inflammation. But as far as massaging your scar, just don't do it. Vitamin E, no use. I hope this helps.